Hi and hello everybody. Welcome to the next episode of Let's Talk Health. Today we're going to talk about something that we utter the word at least once in a day. So which is something very familiar to us, which is going to talk about the back pains. We all have gone through it. But today we have a specialist with us who can explain us what it's all about and how and what are the symptoms, what are the risk factors, everything we need to know about back pains. So here with us, we have Dr. Muralidhar Joshi, Group Head of Pain Medicine and also the Senior Consultant of Anesthesia. Welcome, sir. We are here to talk about a very common topic, as I mentioned. So that is going to be back pain. So, but we all almost, as we talk about it, there are different types of back pains and all. So would you like to give us a little glimpse before you get into the main talk?
Yeah, of course, like more often wordings and all those things. Sometimes we say upper back pain, lower back pain, because basically it all depends on which segment of the back and where exactly you get the pain. So that's how we debate for the upper back and lower back. Like lower back is almost quite common, about 75 to 80%. Upper back is still there for about 20%. Depends on the posture and other things, or something like pregnancy, obesity. They usually complain of upper back pain compared to other people.
Okay. So what do you think causes the lower back pain then?
See, lower back, you should say lower back pain, what are you saying? That's what it's being said clearly, It's the penalty Homo sapiens have to pay for the verticality. Basically, we all know that, from monkey to man. So we are all walking on the 4 feet, now we're standing on the 2 feet. And our back is still evolving, it has not evolved. We are not the completely evolved species. Complete evolved species will come much more later. It's only because that curvature, lower curvature, because of which we start failing. As the day advances, you start working for more than 6, 7 hours, 8 hours, especially as you become more than 35, 40 years, you start feeling that small, like in the back. You feel like you're using a pillow and be comfortable and all. So these are the things why low back pain comes like that. But it can be there for anybody, anywhere in the world. Almost 90% of the population on this earth would have suffered back pain at some point of time or the other. It's that common. It's not the common. Yeah.
Right. So basically back pain is something that almost right in this point of time, almost a 20-year-old person is also facing a back pain and an 80-year-old person is also facing a back pain. But which kind of back pain is something that I'm supposed to be concerned about?
No, question is back pain at any point of time, wherever it is or whatever it is, it's a concern. Question here is, once in a while back pain comes, an athlete in the field gets a back catch and all those because he was playing and all those things, it's a different story. But somebody at the age of 65, 70 years getting it, has some age-related changes and all. Somebody at the age of 35, 40 years is a productive life, and if he gets back pain, if he is not able to perform his routine activities and all, not able to go to office or whatever work he was doing, it affects his family. So many work hours are being lost, and it's a burden to the economy of the whole country. So its economic impact is unimaginable. So that's the reason I'm telling you, back pain at any point of time, not to get worried. It comes once in a while and goes, not to get worried too much about it. But if it's persistent, constantly lingers on your mind that I have got back pain, I'm not able to perform and all, then you should be getting it evaluated.
Okay, we never thought of that far when it comes to a back pain. But nevertheless, what do you think are the basic symptoms that this is the something in the back that needs to be treated as soon as possible?
Yeah, symptoms can be like it might be only in the back pain, or in the lower back, or it might go into the one leg or go to both the legs. Or some people might say, when I sit, my back pain increases, but when I stand and start walking, feel better. But some other people might say, if I sit, I'm comfortable, but if I walk, my pain increases. Someone will come and say, I can't stand for 10 minutes also. So each symptom has a particular correlation for a particular structure, and we have to understand what is the correct problem so that the patient gets the correct treatment.
Okay, but how do we diagnose a lower back pain?
See, lower back pain, one is like history taking it to, like somebody says, I had a fall, I fell down, I had a fracture, or probably somebody has some like fever of long standing, it could be an infection, it could be any of those things. Or sometimes it could be because of pregnancy also, because mother usually puts on weight because she has to feed the baby and all. Okay. Subsequently, that weight doesn't get down off her body. That also adds to additional weight. So the different causes are there. But of course, this is one history, and then we do examination to identify like different structures which might be the possible culprit for, we call it as pain generator, which might be the culprit pain generator. So with that point in mind, if it's like like a recent one onset, maybe last few months or something, usually we put them medications and all. But long-standing one, we get the investigation done, like probably an X-ray or maybe an MRI or maybe like blood pictures and all, as relevant as possible. It all depends.
Okay. Depending now that we know the magnitude of a back pain, what are the basic treatment options that you suggest for these?
One thing is trying to understand, okay, what of back pain is there. First of all, in an examination and all those, usually we have to come to some kind of conclusion. We always start with the conservative treatment and all those, like that we can think of options like physiotherapy, rehabilitation, or probably most important, correcting his position, why exactly he's getting. Someone says, probably I'm doing the daily driving of 12 hours, then we have to ask him to modify his life pattern point of view and all. And question is, first of all, you understand the pain generator, why the pain is coming. That's one thing, educating him. Give an option for him to correct. For maybe symptomatic treatment, you can give some medications as analgesics so that he can be comfortable for a short period. Usually back pain of less than 8 to 12 weeks, usually we don't ask for investigations unless there are some red flags that he has a major problem and we suspect that there could be major this thing. Otherwise, we don't ask for investigations like MRI and an X-ray and all. But subsequently, if the pain persists more than 12 weeks, definitely we're going to ask for the investigations. And that, as per the investigation information which is available and what are our examination findings further, we correlate clinically and then subsequently we decide the treatment plan.
Okay.
Yeah.
But once the treatment is given, how much time does it take for a person to recover from that?
So question here, yeah, exactly. That's a good one actually. It all, see, first thing is that, both the doctor and also the patient should participate in the treatment. If I say tell the patient he has to correct his way of his life, whatever he is doing, then he has to do his part, his role. As a doctor, probably I might suggest some medications or maybe some other options like physiotherapy or whatever things I feel optimum. Those things are fine. And of course, we always come back and regroup after 2 or 3 weeks and assess how's the progress. And even if he feels 40 to 50% better, that means we're on the track. We put them on exercises also, like back strengthening exercises and some stretches so that they can do it in the office or the workplace. That's also equally important. Because ergonomics is one more thing which might be troubling you. So that is one thing which comes, but of course, if it's beyond that, like X-ray, MRI shows some bigger problems, then we have to go for some interventions or some surgical options as applicable.
Okay. Yeah. So now that you have mentioned about exercises and office and all, so can I assume that this does not affect my social life or my life at work, etc.?
No, you should make it a way of life. That's the problem. That's one problem, difficulty in our country like India. We don't take exercise as part of our daily routine. We think it is some extra thing to be done. We don't take it as a routine. The way you have a cup of coffee in the morning, you don't think exercise is part of that kind of thing. It could be just 15 or 20 minutes of stretch or exercise walk. But you think that's additional thing, unless the doctor tells you don't want to go for it, that won't help in the long run. It's more like that. You should make it as a way of life, then it becomes much easier.
Is there anything that I can do to prevent backaches as a whole?
There's nothing to prevent it. If it has to happen, of course, nothing to prevent and all those. Yes, the question here is there are a lot of things, the do's and don'ts will be there and all. You have to assume what work you are doing, how much you want to do or what you want to do. Like for example, trying to lift too much of heavy weight or trying to open a locked door which was there locked for more than 30, 40 years and you trying to do certain things where your physical ability may not be matching that one. You should know where to hold yourself back or take help from somebody else also apart from your participation. That's what you should know.
We actually spoke about the duration of the back pain, but how many weeks or how many days do you think I can stall a back pain? Say it's okay, I can take care later.
It's not a question. The question is, it's not that you should seek for everything, help and all those things. Most of the people, when they come to us and they discuss with them, once I discuss with them or evaluate them, or if necessary some investigation done, then I tell this is your problem, this is the kind of thing. I may not put them on treatment, but they said the explanation that look, this is harmless, not to get worried. You just go back to the exercise and all the back stretch and you'll be comfortable. Don't worry about the back pain. That those words are also sometimes, it makes a big impact to the patient other than talking about medication. It's not like that. Most of the patients, they want to know what is happening to me. That's how. If they know what is happening to me, it's not major, he's not much worried. The first thing, something back and also the first thing comes is, oh, what will happen to my family? What will happen to my work? Will I be able to write the exam? These thoughts increase the
Stress.
exactly, and then the pain increases much higher. So once you know that, okay, it's harmless one, not to get worried, then they accept it. Nobody says no. I say you have to accept it. Most of people, nobody so far has seen saying that I don't know why I got this back pain. No, it's not like that.
Understood.
So no need to avoid. See, you can avoid sun, you can avoid moon. You're part of evolution. I told first statement, it's a penalty Homo sapiens, you have to pay for the verticality. Absolutely.
Nice. Do you think mental stress or something that is going to be bothering us, or any panic that can cause lower back pain?
It can aggravate. Second effect, it can aggravate. The fear factor. Like yesterday, I saw a snake in that room. Today, you want to go there. Somewhere the fear, maybe snake has not left that room. That fear is enough. So that perpetuates like, what is this back pain? Why is it not going? Once you understand we are part of the evolution, yes, you really don't want back pain, probably you'll have to become a monkey. Really, because that time your spine is parallel to the floor. Well, I don't know if the monkeys have back pain or not. I'm not the expert in that sector, but yes, it's not a disease. It's part of the wear and tear.
That's nice. Can you suggest is any stretches or how long an exercise has to happen, or any particular stretches that can help us prevent or recover from?
So usually we tell about not more than 15 minutes in the morning. Exercise you can do during your leisure time, morning or evening, or maybe during the in office hours, whenever it's convenient for you. Simple stretches are there. Probably we can share with you probably at the end of this interview the pictures and also that you can share with the probably the public. It's meant for not only knowledge sharing, nothing more than that. Nothing more than that. I can show the exercise, what to do, what not to do. Simple stretches. In fact, these days everybody works on probably the social media, probably on the computers or the phone and all. So a lot of these things are there, but it's fine. But once you understand these are the do's and don'ts, you start modifying your way of style.
Okay. Do you think any lifestyle changes are required so that I can be aware that this might basically help me in reducing back pain, lower back pains, upper back pains?
I think the fitness is the one thing. Fitness within limits actually. It's not like you really have to become a bodybuilder or something like that. Like, probably a brisk walk for 20 minutes, some stretches and all those things. So total about duration of 30 minutes per day, it's quite good enough to do. Other things also, like you can go for like a swimming or something like that. You can play sports activities, whatever you are comfortable with. Well, avoiding probably the those kind of substance abuse and all those things, because it also definitely contributes to the weakness of the back muscles and all. And see, these routine things are more than enough. Yes, somebody who is really having a major pathological problem, yes, we might suggest certain other things and all.
Now that we have we have spoken a good number of questions about back pains, I would like to wrap up with one last question. How do you think sleep postures and sleep schedules, what type of importance do they play when it comes to lower back pain?
It's very important. If you ask me these days, I keep saying, well, when you have the age and all, you may not feel that that whatever time you sleep and you get up and also you can go back to office. But as you become more senior and all, sleeping at odd hours and odd posture definitely increases back pain. First and foremost thing, like we have circadian rhythm in our body. So we have to fix a particular time to go to bed and like a particular time to get up. I see people working till 3 a.m. and then getting up at 11 in the morning. No, that won't help in your efficiency at all. Because maybe some some defense and all those things and all, or maybe like security guards and all, we do understand they have different responsibility. But otherwise, if there is no compulsion for you to be awake late in the night, there is no business for you to be awake late in the night. You fix a good schedule where when you want to sleep and get up in the morning. Otherwise, what happens when you get up in the morning, you feel very lethargic. You will not be comfortable. You will feel tired and you will not feel fresh. And then you start here and there, late after 4 or 5 hours after you get up, then you start feeling fresh. but by then half the day is over. So in that case, that's one thing. The second thing is sleeping in awkward position, or sleeping on the sofa with something like looking at the OTT movies or something like that. I'm not saying you're not against OTT movies. And you end up with something, sleep in wrong position, you might end up with shoulder pain or back pain. First of all, we have to be little bit disciplined about what we are doing and why we are doing. Fun part is fine, but sleep part, it should be as per circadian rhythm. That's the one way to maintain a good homeostasis within your body. That's the way to go about it.
Understood. So I think we have discussed on the major thing about back pains. So actually, I've never imagined myself talking about such a small thing. According to us, as we people don't actually pay a lot of interest to back pains. But I think we have all learned our lessons that everything has to be paid a lot of attention to. So we'll get back to you in the next session. I think any questions and comments, I think you're always open to put it in the comment section. We'll get back to it at least. So now we know a lot about back pains. Upper back pains, lower back pains, I think we know everything about it. We never thought we can talk about for 15 minutes straight, but just we did it. So if you have any queries for us or our clinicians, the comments below will help you connect with us. See you again in the next session of Let's Talk Health.